Good morning in the United States, good afternoon in Morocco, and good evening in India. Amazing differences in time zones. Warm greetings to you all, distinguished participants and attendees who have decided to register and to be with us in this third episode of the International e-seminars on contemporary issues in media and information literacy. We are so thankful and grateful to you, distinguished speakers, for being with us today. And we also thank members of the audience, distinguished professors, doctors, students, for joining us. I'm immensely happy and glad to welcome you all to the third International e-seminar on contemporary issues in media and information literacy, organized by Moulay Ismail University of Meknes and its Faculty of Arts and Humanities, and the research laboratory L'Arcigals in French, Laboratoire de recherche en communication interculturelle, genre, art, langue, société, and the research group on intercultural communication, dialogue, and conflict resolution in partnership with UNESCO to celebrate the 10th anniversary of the Fez Declaration on Media and Information Literacy and to contribute to the UNESCO-led Global Media and Information Literacy Week 2021. This third episode, titled Listening to Experts, Media and Information Literacy and Science Literacy for COVID-19 Governance, will address the first ever initiative showing the strong interrelationship between science literacy and media information literacy on the one hand, and science literacy and COVID-19 governance on the other hand. We have the honor and the privilege to have eminent speakers who will enlighten us on these complex issues in a way that will help us to see clearly what is at stake, to understand the various dimensions and to take into consideration in post-COVID-19 governance and post-COVID-19 education and engagements with media and information literacy. At a time of crisis and uncertainty, we do need to hear from experts in order not to be manipulated by the non-experts and conspiracy theories. Today, in this exceptional episode, we have the honor to have exceptional guest speakers. I will first introduce the three eminent speakers. Then we will listen to them and benefit from their expertise. The floor will be open to discussion after each intervention. After each intervention, and we will have time to further discussion at the end of all presentations. So as you can see, we have the privilege and honor to have eminent speakers. First speaker is Dr. Mukesh Kumar from the United States. Second speaker is Dr. Priti Shroff from India, and the third speaker is Fatiha El Hilali from Morocco. I will give a brief introduction to present the three speakers. Dr. Mukesh Kumar, he is a PhD in biomedical sciences. He is biologist and immunologist, assistant professor at the Georgia State University in the United States. He is specialist in virology and immunology with expertise in the studies of RNA virus host interactions. Dr. Kumar's major area of research interest is to identify novel therapeutic targets and diagnostic biomarkers for emerging infectious diseases, which include COVID-19, West Nile virus, and Zika virus associated neurological disease. His research involves studying how SARS-CoV-2, causative agent of COVID-19, is transmitted in animals in order to better understand how the virus spreads and how it takes hold in the body. His laboratory is studying the pathogenic mechanisms underlying the development of lung and kidney malfunctions during SARS-CoV infection. The goal from his research with the team is to develop therapeutic strategies to ameliorate SARS-CoV-2 associated disease pathology and prevent the disease transmission. Dr. Kumar has at his credit over 40 articles in scientific peer-reviewed journals, a number of book chapters, and a number of selected invited presentations, over 50 national and international conference and symposium presentations. He is a member as a reviewer in a number of esteemed scientific journals. As lead researcher of the recent study of Georgia State University on COVID-19 attack on the brain, Dr. Kumar will enlighten us on this groundbreaking scientific discovery and sensitize youth on how to protect themselves, their families, and society from the grips of this virus. Dr. Kumar, we are so happy to have you with us today. Thank you for accepting the invitation. We are all ears to listen to you. The floor is yours.
Okay, well, no, thank you. Thank you for the nice introduction, and thanks for having me. And I'm happy to talk. You know, I'm or a policy person, but I'm a basic scientist, as you know. So I can, try to give some basic information about COVID-19 and what we learned in last 1 year of this pandemic, and what my lab is doing, and what kind of implication it may have. In between, I'll talk about a little bit of all this conspiracy theories and some evidence of what we have or we don't know. Okay, so I'm going to share my screen. And if you can't hear me, please let me know or put it in the chat. And if you want to ask question anytime, you can ask. So before I start, right? So just a little bit about us. I'm here at Georgia State University. We are in Atlanta, Georgia. So it's a high rank research institution, and we have very nice what we call a biosafety level 3 or biosafety level 4 labs, because you need these labs to work on these highly pathogenic viruses, right? And we have been working on this for last 15 years, way before the COVID. There are many other different viruses that we have been working on. And since last year, of course, after the COVID outbreak, we wanted to use our expertise and the labs that we have to learn more about COVID-19, right? So I want to thank some of these people who have worked very hard. It's not that easy to work with all these PPE for long hours, but these people, students and posts who have worked really hard last year to get us a lot of data. Okay, so first I will do is that I'll just give some background about the COVID. I won't throw too many scientific jargon, but I will just try to, I have some information just to clear some points, right? So, for example, COVID-19, we all know about COVID-19, and we know it's caused by this virus called SARS-CoV-2, right? So the SARS stands for, severe acute respiratory syndrome. So as the name suggests, respiratory is for your lungs. So this virus mainly affects your lungs, and the CoV stands for coronavirus. So it's a big family. So there's a lot of conspiracy theory about where this virus came from and this or that. I just wanna, there are a lot of things on this slide. I don't want to go over them, but what it's trying to show is that these coronavirus are found in almost all different kind of animals. So there are avian coronaviruses, which are found in birds. There are equine coronaviruses. There are bovine coronaviruses. So there are number of them, and they already, before COVID-19, it was a huge family. As you can see here, this is kind of a chart showing different members. So there are bat coronaviruses, there are some human coronaviruses, there's some mouse coronaviruses. So the coronaviruses have always existed with us. So there's nothing new. We know a lot about coronaviruses. And the reason the name was given corona is not because of any specific region or anything. It's basically because, when you look this virus under the microscope, it has these spikes. You may have heard of these spikes. So these spikes looks like the shape of a crown, like the kings have the crown if you look at here. So that's why the corona is a Latin word for a crown. So that's how this name was, given for coronavirus, right? In humans, actually, there have been a lot of coronaviruses that infect us every year. And, initially there were lots of coronavirus infect animals, and slowly they come into humans. There are a number of coronaviruses like this 229E or OC43. We get infected with them every year, right? And in between always, there have been some outbreaks of new coronaviruses, like in 2002 and 3, there was the SARS-CoV-1. Fortunately, it was very lethal. Fortunately, it did not spread as much. And in between, we had like few other coronaviruses, so one in 2004, one in 2005, one in 2012. We don't hear about them because they did not spread that much. But the coronaviruses have always been emerging, last many years. And now in 2019, we have this, SARS-CoV-2. Of course, we hear it more because it has caused a huge pandemic compared to, the previous coronaviruses, right? So basically, the origin of the SARS-CoV-2 or any other coronavirus, so far in the history has been always from animals. It can be bats. Bats harbor a lot of coronaviruses. There are some wild animals. Even in the camels in the Middle East, we get this Middle East respiratory syndrome. So that actually came from camels. So there has been a lot of history of these coronaviruses being always, zoonotic, kind of emerging from animals and somehow adapted to humans. So it wasn't a surprise that you have another virus coming out, which it has the ability to infect the humans. And once something can infect that many people, then you will have more and more adaptation of the virus, right? So the theories like this came from a lab or this to somebody did it something, it's highly unlikely. Of course, you cannot say no, but highly unlikely. The likelihood goes that it came from the nature like many other coronaviruses have, and there may be future coronaviruses too, because all the animal species have their own coronaviruses, right? Okay, so what makes SARS-CoV-2 a different than, because like if there were so many coronaviruses, why we haven't heard what made SARS-CoV-2 any different than previous coronaviruses? Well, one thing is that always most of these coronaviruses they infect upper respiratory tract, and sometimes they can go to lower, which is mainly lungs. But in case of COVID-19, what we have seen is that it's not only lungs. The virus can cause symptoms almost any place in your body. So, of course, the virus can infect lungs, and people have asthma, people have asthma and all those things, but that's not the only symptom, right? So many people have the problem in their intestine, they have diarrhea and gastrointestinal disorders. Many people have problems with their kidneys, they even have the kidney failure and require dialysis. There have been issues with this blood clots in the blood vessel, which can cause stroke to, heart attack to anything. There had been a lot of reports of dysfunction in the heart. And of course, there's a lot of reports of problem with the brain, especially when people actually, recover from the acute infection. So this is not only a lung disease, it's actually a widespread systemic kind of disease. That's why it becomes difficult to treat, because it's not only treating the virus at one place, it's like treating the various effects of the virus. And the second thing about COVID-19 is that virus doesn't have to go to every organ and infect. There is something called cytokine storm. So you may have heard of a lot in the media, and that's why we are giving all these steroids and IL-6 antibody and things like that. So what happens is that when a virus infects you, your immune system respond, right? So if your immune system responds, sometimes that can be a dysregulated immune system, right? And that immune system can affect not only lungs, it can infect the brain, it can infect the kidney, it can infect liver or any other place, right? So in general, it's a very, very thin line when you're giving need immune system to clear the virus, right? So it's a very thin line when these treatments can be effective. So sometimes they are effective, sometimes they are not effective, sometimes they can even make the things worse because you do need your immune system. So the treatment has to be very balanced, right? So that's one of the reasons that the disease become much more complex. It's just not treating the virus, it has to treat the inflammation, but you have to be very careful when to treat for what, right? Okay. So what we are interested mainly in, one thing that we have completely missed it is called long COVID, and that had become a concern now because, the people who get the acute disease, they, most of them, of course, recover, but a large percentage of those people actually keep on having the symptoms for very, very long time. Of course, the pandemic is new, so we don't know how long, but at least last 6 months or 1 year, lots of people have these uh, long symptoms, right? Which they have completely recovered. They have no virus. They have, but they still can't sense and taste and smell. They have anxiety. They have what we call the brain fog, or maybe called the fatigue, or people just can't walk. They still have persistent cough. They still have persistent oxygen requirement, and all kind of different symptoms, right? Now we don't know what it caused. It could be whatever damage was done at acute infection, or maybe the virus is still persisting at some place, or maybe the inflammation is still persisting at some place. We're not clear yet. And the problem is that there's no protocol to manage these kind of patients, because once you recover from the acute phase, you go home, right? So there's no basic thing how to follow up if people keep on showing these kind of symptoms. And in many countries, it's going to be stigma to, people don't want to tell I was infected with COVID or things like that. So they just won't go and ask for any help. So the problem is that even if these long COVID is only in a very small percentage of people, since millions of people have gotten infected, even that small percentage is going to be a huge number of people, and that's going to be a long-term problem, right? So what happened in this long COVID, we see all kind of symptoms, but most common symptoms that people have seen, it has to do with the brain, the people's mental health. They have anxiety, depression, they can't sleep. There are other severe central nervous system like stroke, headaches. People just can't get the, pain relief. Of course, there are some other like cardiovascular and gastrointestinal as well. But I think looks like a lot of these people have more and more situation with the neurological disorders, right? So when we do our research, right, and I just want to show you a couple of pictures here, for the brain. So these are not from our group, but from people who have died of COVID-19. People have done the MRI and postmortem, and they have found a lot of damage in the brain for many, many patients, right? So there have been several studies which have been published showing that there's definitely a damage in the patients. Now, does that's the only cause of death in that patient? We don't know that. It could be, it could not be. What kind of damage happened? It's very, very difficult to do this in the brain, right? Because getting a biopsy from a brain, it's a very, very risky procedure, which many people won't agree to. You can't even get a CSF. Lumbar puncture is also a very risky. So it's very difficult to monitor that if there was actually a virus in the brain or inflammation in the brain. Lungs are much easier to deal with than, of course, in the brain. So a lot of time, even if people have the brain disorder, it will just go unnoticed because there's no way to really find it out how to do that. Even if people have the long-term symptoms, you can't find out what's going on. It's not that easy, right? So another thing I also want to mention, it's actually quite surprising, is that if you look at the people who likely to report the symptoms on long COVID, it's actually the younger people, the people between 25 and 45 years of age. They are actually the one who are showing the symptoms. And some of them are showing for, I know a guy who is a teenager, 18 years old, and his life has turned upside down. He just can't think. And it's 18-year-old. So we have seen these many patients who are very young, who recovered initial infection fine, but they're still showing symptoms. And one thing is important to remember, if the symptoms are severe, they are easy to notice. But if the symptoms are mild, like in the children's, like, so we say that, okay, there's no disease, it's only mild. Mild mean if they just have little bit of attention deficit or little bit of anxiety or mood disorders, there's no way to know that. It's very difficult to diagnose kind of thing. They will just go unnoticed easily. So these are only the severe kind of long symptoms. The mild, we don't know how many of them possess the mild symptoms, right? So as a research lab, we don't do the policy and other things. Our goal is to find out what's going on and how it's going on, right? So for us, the question is that, okay, if the people are showing the neurological manifestation, what's the cause? Because once you know what's going on, then you can try to do some therapeutics, right? Now, there are different ways it can happen. The problem is that we still don't know. One thing is that the virus can itself go into the brain, which we have seen for many other viruses, because if you inhale through nose, the virus can still straight make it into the brain. And once it's make it into the brain, it can infect any organ, because the brain is controlling your respiratory, your renal, and all other centers as well. But the virus doesn't necessarily have to go into the brain to cause all the symptoms. We know that because there are these blood vessels that goes through our body to the brain and everywhere. So these virus can be in the blood vessel, in the blood cells, and can damage those blood vessels, and that can also damage the brain too. On the other hand, none of that has to happen. Your lungs can only be infected, and your lungs are not functioning properly, and they are not providing enough oxygen to your brain or things like that, and some areas of your brain died, right? So all of those are a possibility. It is possible that in some patient it's due to the virus alone, in other patient it's due to the inflammation from the lungs. In some patient, if they have very high virus, just the infection of the brain could kill the lungs. In other cases, there can be a small damage someplace which can linger on. So we don't know all those things, because like I said, in the humans, it's really, really difficult to study these things, because especially if it's a brain is involved, right? So so what we do is that we mostly use the animal models, that, or the cell culture. We grow the lungs in the lab, or we use animal model, because in animal model you can actually follow them and see what's going on, right? So early on there was no model and people didn't know what to use. So we did these experiments where we infected the mice, the lab mice that we use, with virus, the same virus that we isolated from humans. And you give a very tiny amount of virus in the nose, and what you find out that the animals that you give the virus very, very fast, like within 5 or 6 days, they all die. They all die very fast. And if you look at this, called a survival curve. Basically, what it's saying is that first 4 days they look fine, and all of a sudden they get a very severe disease, and within the next couple of days, just they all die, because they just can't. And they have very, very severe symptoms, and most of the symptoms were actually neurological symptoms. They just could not stand. They have ataxic gait, what we call tremors, and paralysis, and all of those kind of things. So all of those are usually brain symptoms, right? When you look at the body weight too, first couple of days they look fine, but later on they just dramatically lose weight. They look very, very thin. They just can't eat, most likely because of the symptoms that they are showing. So that says that this virus has the capability to kill these mice very fast. But what we wanted to know is that how it's killing it, right? So what's doing? Usually it's a respiratory disease, right? So one way you do it, that I'm not going to show all the data, but just a couple of things that you want to look at, because if you gave it to the nose, it probably landed in the lungs. So lungs should be the main target. And so what this is showing is that these are the viral titers. What that means is how much virus is in the organ at that time. So you could do a study where you can infect the animals and you can kill them every day, just to find out and get their lungs and get all their tissue and see how, because you can do that in animals. Of course, you can't do that in humans, you can do that in animals. And then you can find out, where the virus is and how much it is, right? So the interesting finding was that of course you see a very, very high virus in the lungs when you look at day one. Day one is like you give the infection and 24 hours later you're looking at what's happening to the lungs, right? You have a very high virus and it goes even higher, in a couple of days. So the virus is replicating, right? But then the animal starts to clear it. If you looked at day 5 and day 6, this is a time when animals were actually dying. But look, the virus has gone down dramatically. It's a very low virus, meaning that in the lungs, these animals, although the lungs get infected, but the lungs have the capability to clear the virus. And that's usual, because lungs have very good immune system compared to brain or anything. But when you look in the brain of these animals, their story looks completely different. You don't see anything at day one, probably still in the nose or going to the lungs. But then day three is very little. But when you look at day 5 or day 6, the time when animals become so sick that they just could not stand, there's so much virus in the brain, meaning that these animals are not dying necessarily because they got infection in the lungs. They are actually probably dying that they had an infection in the brain, and they just can't clear the infection in the brain. In this paper we did a lot of other assays looking at the cytokine storm, immune response, or this and that, and eventually, at least in the mouse model, this is what happened. If they are dying, they are not dying because of the lung infection. They are primarily dying because they have so much brain infection, right? Looked at some another thing that we wanted to see how virus may have gone into the brain, right? So there are various ways it could land into the brain. It could go through your blood, it could go through your nose. And what we found was that it looks most likely that it's your nose. In your nose, you have high virus initially, but same like lungs goes down. But if you look at your olfactory bulbs, so this is the area of the brain that controls all of your taste and smell and other things. These are the olfactory system. So you see a lot of virus going up in the olfactory system. So looks like what happened is that when you give the virus, so a lot of virus end up in the lungs, but some virus can end up in the brain. So in the lungs, it goes very fast because you are breathing. So initially the replication starts very, very high, but the lungs controls it. In the brain, it takes a little bit time because it's going through a node, goes to neurons. It spreads slowly, takes 4 or 5 days. But at the end of the day, you have a huge amount of virus now, and this virus could basically kill these animals because there are respiratory centers in the brain and other centers which can be infected by the virus, right? And there have been some, or at least a lot of studies in humans where they have found a lot of virus in this olfactory epithelium, meaning that this could be the route. Now, it may not happen in all the patient, it could happen in some patient, but it is a very good possibility that once you inhale it, some of it could land into the brain, and that could create problems later on, even after once you have probably cleared everything from your lungs, right? These are just a picture. I don't want to go too much in detail. It's just showing, when you do the pathology in the brains of these mice, lots of cells are dying and brain is not healthy. Most of the cells are responding to virus. So what happened usually in this case is that when virus does so much damage in the brain, even if these animals would have survived, they would still have symptoms. And that's what we see in some other studies that we have done, because they just never completely recover whatever damage the brain had was done initially on in the infection. So that could be true in case of humans too, right? And we did some other experiments just showing, these pictures are basically showing that if you take the neurons out of mouse or humans and grow them in the lab and try to infect them, they get nicely infected. So virus has no problem. So in this one, these are the neurons. So neurons have all these spikes and the exons and dendrites. It's a huge cell, right? And then this is the staining for a virus. And when you go local, you can see almost all the neurons are infected. So that these cells are highly susceptible. And it can happen in the brain, in the mouse. Now, of course, it's only the mouse, and how much it happens in the humans, we don't know what percentage, but there's a likelihood, and plus we do know some epidemiological data that suggests that large number of people have the brain disorder, and that could have linked to the direct infection of the brain or direct infection of the neurons. And usually the brain is one of the reasons where most of the viruses like to hide, because we don't have a good immune system in the brain. So lots of viruses like to hide there because, there's nobody to cope with. On the other hand, lungs, it's very difficult to survive in the lungs. So yeah, that's all. I don't want to give too much data. It's just a basic summary that we know that some of these COVID-19 patients develop this neurological disease, headache, they have loss of taste and smell, meningitis, cognitive dysfunction, memory loss. We know that the neurological sequelae in at least 1/3 of human cases, so that 33% of all the infected patients have some kind of neurological sequelae. There is some data in both in humans and the animals that suggests that SARS can infect the brain cells. So that could be the direct reason for doing all those. But at the same time, even if the SARS cannot infect the brain directly, there's also a data showing that the inflammatory response, the cytokine storm because of the SARS could also lead to these symptoms as well. So it has to be a very, if you need to manage these patients, it has to be very carefully managed. So, people came up with some kind of hypothesis like how what COVID-19 clinic should mean. It should not mean just initial people come in and once they test negative, it's all done. You go home and everything is done. That's probably not the case. You probably have to have these patients for the follow-up. You have to follow up them, I mean, 4 to 6 weeks or 12 weeks after discharge, or maybe a couple of months after discharge. Maybe look at their neurological symptoms. Do they have a problem in anxiety, depression, maybe kidney symptoms, because we know that a lot of patients have those. Maybe the brain hematology, looking for some kind of clots. Maybe this, I know there are lots of patients, so this may not be done for all of them, but maybe some high risk patient, people who had very severe COVID early on, but still the patient survived. So you know that this patient could, end up in a big trouble later on. Or maybe the people who are already like diabetic or cancer patient or things like that, where you know that the risks are high. You have to follow them for months after the infection. And there have been actually cases in US where people have done suicide because they could not cope up with the long COVID, so in some people, but there's absolutely no protocol, even in the US or any country in the world, where they have any program to follow up on any patient. And even the clinical trials or anything are very, very rare. People don't want to believe that the brain or all these long symptoms could be a huge issue. But like I said, considering how many people have been infected, even if a small percent would lead to a huge number of people who had long COVID. I will stop here, and I will take any questions that you guys have. I wasn't sure what really more to include. I don't want to include too much of my lab data, but I hope it made sense.
It does make sense. Let me just say hello to Dr. Pretty Shraf. Welcome.
Hello.
I was afraid lest you would not be able to attend. Sorry, we have started some minutes before you join in us. Dr. Kumar, thank you very, very much for this. You are a scientist, but what I like in the way you write your articles and the way you have presented is that the layperson, the general public can understand you. When I read your article, so many questions which were unanswered in my mind, I got the answer, and I said, no, this person is fabulous. He has the capacity to explain the things. So this knowledge should be transmitted to the large possible number of people, because it is only when we know that we are sensitized, and it is only when we know that we can take our precautions and fight all against the virus. Thank you for sharing your knowledge and your experiences and expertise with us, because the idea is not to do experiments and innovate. The idea is to share this knowledge. The knowledge and information become empowering only and only when they are shared and they are accessed by interested people. Listen, when I read your article, I got answers to my questions, and when I listened to you, it was confirmed. But I got at the same time wary. You see, afraid in the sense that when you are afraid because you see what it means, you see the implications, you see that it is a matter of life and death, you see that even if you recover from it, you may have some irreversible consequences. You will suffer from them throughout your life. So knowing all this, you take all the precautions and necessary measures. So, of course, Dr. Fatih Al-Hilali and Dr. Shraf, you can ask questions to Dr. Kumar. I have three questions to start the discussion. You said in your presentation that SCOV has been living with us in many forms. What has happened? What did happen to have this particular type of SARS-CoV, which is really deadly and dangerous, and to which you did not, the international community has not yet found a solution? The second thing, it is this explanation between when the virus attacks the lungs And when the virus attacks the brain, the discovery for which you should be applauded, and I applaud you and your team, is this discovery that when it reaches the brain and when it attacks the brain, uh, it has severe, irreversible consequences. It can lead quickly to death. Why? Because the brain is the organ that controls all our body. So once in the brain, it can attack any organ. Second, because the brain is not equipped with immunity, with the immune system of the brain is not as strong as the immune system of the lungs. So all these things show the difference between the people. There are some people who recover, there are some people who die, there are some people who do not die, but still they have severe consequences and they cannot live their normal life. The third question, Dr. Kumar, is about the young people, youth. You mentioned 20, 25 people age group. You mentioned the people less than that 10 years old, because at the beginning of this COVID-19 pandemic, we were informed that children are immune, young people are immune. So these young people, they have never taken all the necessary preventive measures, but then the infection has spread in society, and now they are paying the consequences. So if you can elaborate more on these three
Yeah,
questions.
sure,
Thank
sure.
you.
I will try to answer, there may be a common answer to a couple of your questions. So to
Okay.
answer the first one, right, what happened this time, like why, since there were always coronaviruses, so what happened, specifically this time? That's $1 million question. If people know the exact answer to that. But and the second to a third question was also, it's very related, where you say that why now children are getting infected more, right? So after studying virology for 15, 20 years, what I know, what I learned about viruses, they are definitely smart, and they have a huge immune pressure. When they go in our body, they have a huge immune pressure. If they don't outsmart us, they get killed right away, right? So the thing is that the once the virus starts circulating, whenever the virus first attacks, it always attacks the people who are less immune, like less healthy, because it cannot handle the immune system. So it starts always with elderly, it starts always with the people who are immunosuppressive or things like that, because it has less pressure. But the pressure is still there. But what viruses do is that they mutate. They get adapted. They get adapted. They start looking at what's the thing around here, what I have to avoid to survive, right? So those are the things. Then the virus start getting adapted. So once they start getting adapted, then they can infect more people. Now they have gone under the selection process. Now they can infect more people, because the target for a virus is to two things. It needs to replicate and it needs to spread, right? The only way to spread is that if it can infect more people. See, a smart virus doesn't want to kill its host, because if I kill the host, the virus dies with it. A smart virus wants to infect more people but kill less people, and that's how they get adapted. So that's how what they eventually every virus like to do is that it survives with us without killing us. Maybe kill few people, but just able it, because if it starts killing too many people, then it will just disappear very soon. So the what happened is that when the virus, lots of people get infected, virus get adapted, then it can infect more people, but may not kill more people, maybe even kill less people, but it's able to spread more. So that's what all these variants they do. They just spread too much, because now they got adapted even to the younger population, even though it's not killing the younger population, but it's adapting to the younger population, right? So it can still spread, right? And the second thing is that why would all these long COVID and things like that. Again, that again goes with the thing with the virus. So any virus or any bacteria, they have 4 regions in our body. We have only 4 regions in our body, what we call immune privileged site, meaning that they don't have an immune system. That includes your brain, your eye, your testes, and placenta, or baby. So they are all protected by very strong barriers. One is called the blood-brain barrier that protects the brain. One is called the brain retinal barrier that protects your eye. One is called the brain testis barrier that protects your testes, or one is called the placental barrier that protects your baby. The reason is that these are all very delicate organs, and too much immune response can be deadly for them. So these are all protected. So for a virus, if any smart virus wants to live longer, it has to go to one of these things. Otherwise, the ability of virus to live too long in the lung or a liver is very low. Maybe sometime in the livers, but living virus living in the lungs, which is so much immune response, so much things going in there. So they like to go to some of these area where they can hide, or maybe they can persist for a long period of time, so that they are still alive, right? And lots of viruses do that. We don't know exactly if the coronavirus is doing that, but based on symptoms and things, it may be possibility, right? So like I said, like these viruses adapt, they mutate, and they could be with us for our life, but most likely won't kill us, because that's the only way they can live with us for our life. And if they stop killing us, they can keep spreading, but stop killing us, right? And then another question, I don't know what was your question about the yeah. So the thing about the brain, right? So brain controls everything, right? So, and if you, I think lots of these death that happens, especially I'm looking at India too, it's probably because of a lot of mismanagement, and there has been a lot of bad science that has been done, including one of ivermectin, which I wasn't involved, but I was part of when that paper was getting published. But so there have been a lot of bad science that has been done. There has been a lot of people are giving a lot of antibiotics and a lot of antiparasitic zinc, this and that. I don't think any of that is good. It's just giving the virus a good environment to keep replicating. And with all the steroids and everything, dexamethasone and all those, they're all good. But like I said, with the virus infection, it's a very, very balanced. If you give it too early, virus will keep replicating. If it's keep replicating, it's going to kill you anyway. But if give it a little later, how late you can give, you don't know, because we don't every patient is different. So a lot of these patients may have died just because they were given steroids early on. They just virus just keep on replicating, and then they just wrap up the body. Nobody is doing any postmortem or anything to find out what's going on in these patients when they are actually dying. So and that with the adaptation, the virus is probably going to infect more and more organs. It won't only go in the brain. Eventually, it will go to liver, spleen. It will get adapted to everything if it stays in the society, because that's what they do. They get adapted. I don't know if that answered the question, but
Yes, thank you very much. It did answer the question. Dr. Fatiha Lilali, Dr. British Rock, do you want to ask any questions to Dr. Kumar?
Yes, Mike, can you hear me?
Yes.
yes.
Thank you, Dr. Kumar. This is very enlightening and frightening at the same time, because we are witnessing what you are showing as a scientific theory that is happening on the ground. So, my question is, and I'm going to address it when I speak in a minute a little more, but how do we now educate our government policymakers? How do we create awareness among the public? What ways would you recommend that we educate the people and public?
Well, I think it depends. Many countries have done really good in how they have handled the pandemics, and many countries haven't done, really good. And I think one of the things that has to be done is that the public has to have a trust in the information that's coming, and that's what people are losing it, because they're getting information from every place, and they don't know what to believe. And even if you give them a good information or good awareness, they just won't believe you, right? So it has to come from some place where the people that the personal that general public trust. So usually that has to be like, you have, like, people make these task forces, right? So those task forces have to be given more power, and they have to be more broad. Like, they include all good scientists plus policymaker, experts from every field, and then they tell public every regularly what's going on, what's the data. So they are like expert, real educated expert who are expert in their field. They come on the TV and then tell people that, okay, this is the new finding, these are the new findings, these are the evidence based. So believe this stuff and don't believe anything else. So there have to be a central effort. If everybody effort is individual effort, then they all get lost, right? For example, somebody really needs to tell these people that, like I was reading a news in Goa that the guy said that give ivermectin to everybody. Ivermectin is a really bad drug. It's not even a good drug. So there has to be somebody coming up and say that that's not right. You cannot do that, right? So there's all kind of misinformation. And like I say, I'm not expert on making policy and all those things. I'm just a scientist working in the lab. So, but I would say that, like in US, we had, Dr. Fauci, and there's at least one or two faces where lots of people wants to believe, right? So you have to put those scientific faces out in the public, and, with all the different experts, and have regular briefings with the public, let them ask the questions or things like that. So there has to be a reliable source of information. Until that happens, it's going to be all over the place, right? So
Which is the case just now in
which
many,
is the
many.
case just now, right? Because people hear so much information. It just, I believe that lots of people are dying because of all this mismanagement rather than the COVID itself. It's just so bad, because all these, the cases coming up with black fungus and oxygen, these are all related to steroids or maybe bad oxygens or bad immune system. And that has to do with all the different things people are doing to save themselves. I mean, I'm really appalled to see people were literally spraying bleach everywhere. That's not going to kill anything. If definitely not corona. You can spray whatever you want to spray and whichever way you want to spray. It's not going to do anything. So it just, I mean, yeah, of course, for our hand and everything is fine, but spraying, everywhere is not going to help. So there has to be somebody who coming up and say that, this, it doesn't work, and we don't need to do that. But we don't have. I mean, I don't know. Many countries don't have that kind of, person coming up, and I don't know how that can be achieved, but.
That's the challenge for the educators now, right? We'll have to figure that piece out now. Thank you.
Yes, absolutely, Dr. Sharaf, and I fully agree with Dr. Kumar. Yes, for raising this issue of not only misinformation, but disinformation, which is made on purpose to manipulate people. Because you see, in times of crisis, when we do not have access to reliable information, as you said, there should be updating regularly. People with well-known scientific figures, people trust. The mass media should play an important role to fight, and those in government, those in public health. It is a concerted effort, joining efforts to give us the information we need to help us understand. And we have witnessed poor leadership and poor communication skills. And this is why this has led to all these types of misinformation and disinformation, as you rightly stated, Dr. Kumar. Maybe disinformation has killed more people than the actual COVID-19. And as Dr. Pretty Shraf rightly stated, it is time for education, and it is time for media and information literacy. We need it now more than any time before, because it is a question of life and death. So thank you very much for enlightening us on all these issues. As Dr. Priti Sharaf, yes, it is scary, but we need to be scared in order to be able to take it seriously. We should take it seriously in order to apply all the preventive measures and protect ourselves and protect society, waiting eagerly for the time when scientists will find the cure and will help the world get rid from this virus. So if no other questions now, the second speaker is Dr. Priti Shraf. Let me introduce I will just take some time to introduce her. Dr. Preeti Shroff Mehta. She is a PhD in International Education Policy and Leadership, Dean of MICA India, and Head Leadership Management and Executive Programs. Dr. Shroff is the Dean and leads India's premier MICA, the School of Ideas, since 2016. Well known for management, marketing, digital transformation, media and entertainment, industry management, communication, and creativity. She also leads the Management and Executive Development Program Global Partnerships for MICA Studies on Global and Digital Governance, Women's Leadership, Place Branding, Creative and Culture Industry, and Circular Economy, Sustainable Business Leadership. Dr. Shroff has over 25 years experience in international management and development, democratic governance, public and private sector partnerships, and civil society capacity development. Her experience and expertise include program management and training in leadership roles across the continents: Africa, Asia, Middle East, Europe, and North America. She has an extensive big number of publications, of book chapters, of participation in international conferences, and I would like to mention two books on which she is actually working. They are upcoming. The first book to be published in Routledge Group is titled Global and Digital Governance Futures. I think it is closely related to our topic of today. And the second book is to be published with the Routledge Publication Group is on women's leadership path, workplace and life transformation. Sorry, Dr. Shroff, but if I have to say all your experience and expertise, it will it will take so much time. So I have summed up. The topic Dr. Shroff will be dealing with and enlightening us today is complex and multidisciplinary, interdisciplinary science, communication, and change management leadership for COVID-19 governance, importance of media and information literacy. We are so happy and so pleased with your presence with us, Dr. Shroff. We are all ears to listen to you. The floor is yours.
Thank you so much, Dr. Drisha. Always a pleasure to interact with you. And we have invited you to contribute a chapter for the book. So you are also now part of the Global and Digital Governance Futures project.
Thank you
First
for the
of all, I would
invitation.
like to thank, yes, and thanks to your university and UN agencies that are supporting such important reflections on role of media and science literacy. I do want to acknowledge the loss of lives around the world at the moment. So many families are suffering who have lost family members, who have people who are COVID positive. So we are going through a very, very difficult and painful moment in the history as a global community. And I want to open my presentation with a simple story that I heard from one of the MICA colleagues recently. They are a young couple, so he and his wife had a daughter 1.5 years ago. And his daughter has not left his one room in the house because she cannot go out and play. She looks at the world from her window. And that is her understanding as a young child of socialization, world, cultures, all of this is experienced by her, this little girl, from the window of a room in a small place that where they live. And this is so disturbing apart from the loss of lives that we are witnessing. And the question is the world that this young girl is inheriting as we speak. And that's why the topic I have chosen is about leadership of educators, leadership that media will have to show, leadership that will have to cultivate in society to be responsive to this little girl and so many children around the world who are growing up in the digital and post-COVID world. So let's reflect on that a little bit. I want to upload a slide, so let's hope if I can upload it. Can you see this?
Yes, it is visible to us.
Okay. So I think the most important aspect that I want to discuss today is science literacy and the critical role that educators will have to bring in terms of science literacy in schools, how we bring that to schools and education institutions for students of all disciplines. We can't say science literacy is only for science subject because we are facing a global health crisis, and science, health and technology in post-COVID times will have to be taught across all institutions and all subject areas, which I think is a very different approach now, the way we plan education. So education administrators, educators, faculty, teachers, all of us will have to think through how do we bring science literacy to classroom, not just for the theory part, but application of it for problem solving in society, because that is the definition of science literacy. You take the knowledge and you solve societal problems. So that's why I want to start with the interaction of science, society, and the role of government in policy making, and not just talking about scientific knowledge in schools, but providing medical services for everyone, not just those who can afford, not just countries who can have the vaccination. While we are vaccinating probably 2% of world's population, I think over 90% of world's population still doesn't know whether they will get access to a vaccination, whether they can cure people who have already COVID, what Mukesh Kumar was talking about earlier. So these are the important questions that scientific community, government community as leaders, and societal leaders will have to think about. So that is the first thing that I wanted to focus on. Other thing I do want to focus on is, can you see the slide? I think I
You have
lost
lost, we have
the
lost the
slide.
slide.
Yeah, I just um, let me see what I can do. Just give me a minute. I think we lost the slide I had. Okay, it should come up again now. Okay,
Yes,
can you see it?
yes, we can see the slide now.
Okay, all right. So what I want to focus on is what is scientific literacy and how do we communicate that literacy in schools, outside of schools, in government, in private sector, and for the public in general. And these are different approaches that digital platforms and media will have to be very capable, because we cannot afford to have irresponsible media, false information, and misinformation and no information, right? All of this is creating such problem for people in day-to-day lives. So responsible and ethical media and their ability to communicate scientific knowledge is going to be extremely important. So what is the purpose of scientific communication? One is highlight any crisis that is scientific or health related, that's a pandemic that will impact every single human being, share recent findings, scientific findings, and create learning excitement for science so that people can see the connect between scientific theory and scientific application. Second, increase mass approaches and public appreciation of science, because people would say, what have I got to do with science? But in today's world, we have science, technology, digital platform. This is all interconnected and it's impacting us. So every person has to have scientific literacy and scientific awareness. So how do we create mass awareness campaigns through media? That becomes very important. Third, we have to keep learning about increasing scientific knowledge and understanding. So learning is now lifelong. We can't say I graduated, I got my degree, master's or PhD. We all will have to be lifelong learners. Fourth, how do we influence policymakers for right decision making, for correct policies where everyone has access to health, everyone can have access to medical services, and everybody can get those services in time? So there are societal inequalities, and we have to address the issue of poverty, unemployment, and how to help people who are impacted by COVID as we move forward. How do we give access to education to that little girl? How will she learn from home? More than 80% children in India don't have access to digital education. So what are we talking about in post-COVID world that we will not have access to digital education? Do we know how many children can even access digital education? Rural areas, children who can't afford technology. What do we do for them? So these are important questions of policy preferences. The next question is behavior. Mr. Mukesh, I outlined the issue of governance gap, policy making gaps which have affected us. Behavioral issues are also equally serious. All over the world, people don't want to wear masks. They are still arguing. Government is still trying to convince. People are still going out infecting each other. So how do we change people's behavior, and how do we teach behavior change communication in schools and outside in society? So behavior change campaigns that media must focus on, and they should partner with government and education institutions and focus on behavior change. Then how do we encourage multiple perspectives, diversity of perspectives from experts in science, experts in technology, experts in media, experts in cultural understandings? Because disease and impact is playing out differently in different countries, because we have different cultural belief systems, we have different cultural practices. So science interacts with a culture, and we must understand that we do have to analyze science in relation to and governments. If we don't look at it in this holistic way, we will not succeed as we move forward. The final point is we all will have to become problem solvers. See, in education, we focus on lot of inputs. We design courses, faculty has knowledge and they impart that knowledge. The question is, are we helping students to apply this knowledge for practical problem solving? So there are two models of learning that I have outlined here based on an article that I was reading. One is, usually we have knowledge dissemination through experts. That is the first model. So then the question is, how do we get these experts to engage in formal schools? So how do we bring scientific knowledge and scientific experts to engage with formal education institutions? And then how do we engage them to work with the masses? And that is where role of media and digital platforms is very important. But then the question is, are we educating students and teachers to become digital experts? Are they comfortable utilizing digital platforms? So in that sense, we need to create a new generation of educators who will be comfortable with mass literacy, who will be comfortable creating online campaigns, and that requires training and capacity building. So that is one model. And the other model is, how do we create partnership that is collaborative, where public, experts, and communities and education leaders work together collaboratively, not just in one country, but across countries, to learn from each other. And this is so critical, because we do have to learn from different perspectives and learn to engage with different stakeholders. So, the final point that I do want to make is, we will have to teach diversity and respect for diverse knowledge traditions, different cultural traditions, different societies in our schools and in our education institutions, so that our mindsets open up and we learn from each other, we learn dignity of others, we learn to respect others. Because in a global crisis, only when we work together, we will find a solution that will be applicable for people around the world. So no longer we cannot talk to each other, no longer we can go to wars. We need to build peace with each other, one step at a time. And the final point I want to make is, focusing on children and next generation is extremely important in government policy planning, in education policy planning, and media's role in constantly helping us understand the mental health issues children are going through, mental health issues parents are going through. So, how can media create the post COVID literacy, and how can media become a positive change agent and help us with change management? So, change management will become a critical learning area for educators, for students, for administrators, for politicians and policymakers, and ultimately for media and media stakeholders. And I do want to make an appeal to media actors, media platforms, media agencies, that please recognize people don't have information, they have misinformation, and it is the role of media to make sure that what information you give public is factual, responsible, and ethical, because it is that little girl that I talked about in the beginning. Her future and her life is at stake, because if we don't become responsible global citizens, we will keep losing our family members and our children. So let's come together and create scientific literacy in schools and in society, and media literacy, and using media platform in a way that helps all of us face this global crisis. And once again, I wish well to families and people around the world who will listen to this conversation. And thank you, Dr. Drisya, for inviting all of us for this sharing.
Well, thank you very much. Grateful and thankful to you. You have raised so many issues. We can, each issue deserves one international conference or conference to tackle it. But even, in fact, this is it. How to have cooperation between scientists, media professionals, policymakers, and educators, leaders in education, to take into consideration the importance of health literacy, the importance of science literacy, the importance of cultural diversity. I love the connection you made between disease and culture. Sorry, I forgot to say that. Well, I'm really saddened with the surge of COVID-19 in India. We in Morocco, we are all our hearts and minds are with the people of India. Uh, and we do hope that you can get control of this surge and the number of deaths. It is inconceivable. It is difficult uh, to see now with the we have started to get hope with the vaccination and all, but what you said, Dr. Shraf, is the key issue. People are not paying attention. People are not taking it seriously. How to help people change the way they think, because if they change the way they think, they will change the way they behave. Now, how to make them change the way they think? It is by providing them with the information, with the knowledge, and with the skills. It is, in fact, it is a question of education from the early stage up to adult stage. It is a question of responsibility to have ethical, responsible media, and to the mass media themselves should give priority to health. The time and space devoted to health issues and to science issues is so slim if we compare it with other types of programs provided by the mass media. So we should teach our children, we should teach our students two basic skills: critical thinking and problem solving from the very beginning. You are fully right to relate the science and culture. Everything is context-based. Everything is culture-based. Different behaviors, different attitudes, and different reactions from people belonging to different cultures. And we are citizens of the world. The two approaches you have talked about, Dr. Shraf, the first model is knowledge dissemination at the local level and the national level, and then the cross countries collaboration. I think that they should go together because they complete each other. We cannot rely only on collaboration with the others, and we cannot limit ourselves to what is happening at home. So there should be this interrelationship. It is sad to see that what is called the global world or the global village has become the isolated nation space with the COVID-19. You see, each country thinking about its own people, no real support, no real cooperation, no real partnerships. So the COVID-19 has shown the fragility of the whole world system. It is to be rethought. New ways of thinking for all, new ways of behaving, new ways of partnerships, because in fact, we are all different, we are all unique, but we live all in one world, and we should collaborate for the survival of all and for the survival of humanity. The human touch should be there, and knowing the other will lead us to understanding the other, to collaborating with the other, even to love the other. Why not? So many things. I'm grateful to you. It is your lecture should be taught across, and as I have been advocating that media information literacy should be taught across disciplines and across ages. You are fully right to say that science literacy should be taught across disciplines and across ages, and it should be included as a fundamental part, key part of media and information literacy, because sooner, the earlier we start at the preschool, at the primary school, it would be better. The more we know the various diseases, or how they are caused, why they are caused, how to protect ourselves from this, we will be able to protect ourselves. So congratulations, happy. I am. Uh, you are a leader in the educational sphere and in the communication sphere, and I'm sure and confident that you will help in producing a vision not only for India but for the world. As you said to Dr. Kumar, it is time for educators to
Yes.
join hands with the scientists and to join hands with you see the mass media. It is a global move with all components of society that will make the change. Thank you very much.
Thank you. Shukran.
So if no questions, I will now give the floor to Dr. Fatiha. Let me first introduce her. Dr. Fatiha El Hilali is a PhD in immunology and hematology. She is a healthcare project manager, Mohammed V Hospital, Meknes, Morocco. She is a research collaborator, Department of Hematology and Oncology, Children's Hospital, Los Angeles, and United States. This shows the, you see, international cooperation, which is very good and excellent. Her education, PhD in immunology and hematology, master's in microbial biotechnology, Bachelor of Science in biology, and lab technologist diploma. She has been a laboratory manager since 2002. She has participated and contributed and coordinated a number of international conferences. She is a reviewer in a number of scientific peer-reviewed journals, and she has a pedagogical experience in more than 3 universities in Morocco. She has at her credit a number of publications, articles published in scholarly peer-reviewed journals. So her topic today is the extraordinary immune system and COVID-19. Dr. Kumar has talked about the immune system at the level of the lungs and the immune system at the level of the brain, stronger at the level of the lungs, not well equipped at the fragile at the level of the brain. Dr. Fatiha El Hilali, who is specialist in the immune system, will give us more details about the immunity and how to strengthen our immunity and how can this immunity protect us from COVID-19. Happy and pleased to have you with us, Dr. Fatiha El Hilali. We are eager to listen to you. The floor is yours.
Thank you, Professor. Ladies and gentlemen, I'm happy to be here with you today. What we should know about our extraordinary
Dr. Fatiha, you are muted.
I'm here.
You are muted. Fatiha Al-Hilali, you are muted. We do not hear you. Dr. Fatiha Al-Hilali. Dr. Fatiha.
You need to unmute your.
Yeah, yeah.
Yes,
No,
now it's
Dr.
better.
Al-Hilali.
Yeah. I think I was disconnected. That's why. So do you see my screen?
Yes, yes, we see the screen.
So ladies and gentlemen, I'm very happy to be here with you today, participating in that important event. Never has there been more focus on the value of health and our immune system than this in this period of the pandemic. So I'm going to talk about what we need to know about our extraordinary immune system and the COVID-19. So what exactly is immunology? It's the study of our immune system, including all physical, chemical, biological reaction of the organism against the foreign substances. So it clarifies how our immune system protects our body from the ill effects of inflammation, infection, and cancers. So there is still so much that scientists don't know about optimal immune responses. And if there is one thing we know for sure is that if our immune system fails, it can result in acute and chronic allergy development, progression and spreading of cancer, autoimmune diseases, and aggressive progression of cardiovascular neurodegenerative conditions such as Alzheimer. So immune responses is triggered by antigen. What is antigen? Is a substance, usually protein in nature or sometimes polysaccharide that generates a specific immune responses inducing the formation of specific antibody or specially sensitized T cells. So our immune system is very complex at different levels. It's including organs, spleen, lacrimal gland, tissues, lymphatic, bone marrow, cells, white blood cells, macrophages, Kupffer, microglia, subcellular T lymphocytes, B lymphocytes, Treg cells, fluidic lymph fluid, plasma, humoral complement cascade, and cytokine. So self and non-self discrimination is the crucial function of our immune system. So what's self is the body's own cells, and non-self is foreign or abnormal cells like bacteria, viruses, or cancers, cell cancers. So all nucleated cell of our body possess a unique and distinctive human leukocyte antigen, which called HLA. They are proteins that's unique to each individual organism. So they are involved in self-non-self discrimination in a different way. They are surface molecules that identify it as self. So these self markers function as identification tags. So HLA is very diverse. It contains 200 genes, more than 5,000 different alleles, and 7 million base pairs. We can say that all creates donator. So HLA, the most important function of HLA is in induction, regulation of immune responses and selection of the cell repertoire. So we can say that HLA is nearly unique. So the immune responses is nearly unique, and each individual's immune system is also nearly unique. So what about HLA diversity and COVID-19? So HLA alleles are critical component of viral antigen presentation pathway. So it's one significant factor modulating resistance and susceptibility to viral infection. So HLA polymorphism results from a set of amino acids in binding, epitope binding sites and T cells presentation. So we can say that genetic variability in HLA allele might influence the immune responses in patients with COVID-19, modulating disease severity. So COVID-19 immune responses could be adverse or protective. So we can give an example of HLA diversity. The patient with positive HLA DRB1, those patients have a good or better immune system. They overcome infection like salmonella and cholera and had advantage in evolution. But those people develop severe COVID. So we can liken this aggressive immune system to two cars. One car which is driving at 30 kilometers per hour and a car which is driving slowly. As for the Ferrari, the crash could be fatal, and but the Fiat that goes slowly will easily return to its way after the crash. So people with HLA DRB1 got an aggressive immune system. There are two types of immunity: innate immunity, which is non-specific. Responses are the same for all pathogens, ready to go, first line of defense, no memory, and including physical barriers like skin or cells like macrophages or neutrophil. The adaptative immunity is the second line of defense, is very specific to the pathogen, building memory of encountered infection, including B cells, which makes Y-shaped protein called antibody, and T cells, helper and killer T cells. So this micrograph shows the damage occurred by antibody on E. coli. So that's B cells which producing antibody. So one of the more hallmarks properties of immune system are the memory cell. So immune system has the ability to remember past exposure to pathogen. So it's memory cells got some properties like long lifespan, high sensitivity, quick and robust proliferation, and high affinity antibodies. So what's the application of immunology? It's surely vaccine. Vaccine contain antigen that trigger immunity but do not cause the disease. So upon re-exposure to the same antigen, memory cells will trigger a faster and stronger immune response. So when the immune system gets sick, people could get autoimmune disease, cancer, asthma, and allergies. So what's autoimmune disease? When the immune system can't tell the difference between your own cells and foreign cells. So immune system make a mistake and attack the normal cells. Example, rheumatoid arthritis, immune system attack our joints. Type 1 diabetes, immune system attack pancreas. On lupus, immune system attack the joints, lungs, blood cells, nerves, and kidneys. Multiple sclerosis, immune system attack the nerve cell. And Crohn's disease, the lining of intestine, and Hashimoto disease, immune system attack the thyroid gland. So in asthma and allergies, which are a hyper-responsiveness of the innate immune system, they are occurred when the immune system develops an exaggerated immune response with some specialized cell like mast cell, macrophage, and eosinophil. Cancer also, when the immune system gets sick. Cancer is caused by changes like mutation to the DNA within the cells. So the question is, why immune system couldn't fight cancer or attacks cancer cells? Why? Because the cancer is escaping the immune system by avoiding the immune recognition and inactivating immune cell, but producing some molecules that make them stop working, like PD-L1, or changing their local environment, so it's become a hostile place for immune cell to work by secretion of suppressive molecules like IL-10, TGF-beta, and prostaglandin A2. So what's the immunotherapy? It's a kind of upscaling our immune cells. It's a treatment that uses a person's own immune system to fight cancer. It can boost or change the way how our immune system works, so it can find and attack cancer. Nobel Prize on 2018 was awarded for checkpoint inhibitor discovery. So it was ipilimumab and nivolumab. So also immune system could get cancer, including lymphomas and leukemias. So what infections disease are disorders caused by organisms such as bacteria, viruses, fungi, parasites. So like SARS-CoV is a virus, and many organisms live in or on our body. They're normally harmless or even helpful, but under certain conditions, some organisms may cause disease and death. So COVID transmission, in general, transmission could be from a person to a person by insects, animals, food, water, or organism in the environment. And SARS-CoV is transmitted with respiratory droplets and aerosol. Symptom of infections vary depending the organism causing the infection, often include fever and fatigue, but there are some mild infection and serious infection that needs hospitalization. So for COVID-19, the spectrum is large. We can start from asymptomatic infection, mild illnesses, moderate, severe, and critical, and long COVID-19. So who is at high risk from coronavirus? Being aged more than 65, cardiovascular disease, obesity, cancer, diabetes, chronic kidney, and being pregnant, smoker, and recipient of transplants. And we should not forget about HLA, the important determinant of disease severity. So now immunologists are sure that everything is infectious until proven otherwise. So infection could cause cancers, infectious disease, chronic diseases, and autoimmune disease. So how is our immune system nowadays? Are we at risk? There is 140,000 chemical on the market: industrial, agriculture, modern lifestyle, wireless technology, medicine, imaging technology. So like 20 scan radiation, it's equivalent to Hiroshima atomic bomb survivor. So what about the immunotoxicity and our immune system? There are many consequences like immunosuppression, hypersensitivity, and some autoimmunity like ASA, which is autoimmune syndrome induced by adjuvants like silicone. So today we are living with too many chemicals, infections, stress, inadequate sleep, obesity, poor diet, lack of physical activity, and that could affect our immunity. So what we can do, we should first avoid infection, washing your hand frequently, cooking meats, don't smoke, don't drink alcohol, eat a diet high in fruit and vegetables, eat some herbal medicine, green teas and nuts, exercise outdoor regularly, and maintain a healthy weight. Get enough sleep and try to minimize stress. And thank you so much.
Thank you very much, Dr. Fatiha El-Hilali, for this highly informative. Could you please stop sharing your screen? Dr. Kumar has raised the issue of COVID-19 attacking people with less immunity. But at the same time, we have COVID-19 when people get infected. The COVID-19 weakens and fragilizes the immunity. So how to make sense of all these things, attacking less immune, but when it infects people with immunity, because it did infect people with immunity, it has severe consequences on these people. You talked about the memory cells. Can't they work in favor of the patients when they are when they get infected by the COVID-19? And then some scary information also in your presentation, when the immune system attacks the body cells, own cells. So does it apply also to the COVID-19? How can we do? What should we do? What are the preventive measures in order to be immune, in order not to have these immune system attacks, and in order not to have the immune system attacking us in our own body. Thank you.
Do you hear me? So COVID-19 is an immunological disease. So for some people which that have like aggressive immune system got the severe COVID-19. So it's an immunological disease. The severe symptoms happened to people which got that kind of immune system which called aggressive immune system. And the second things is our immune system is already weak. So we got a weak immune system plus immunological trouble. So people could get that severe symptom or death. After the first exposure, for the second question, after the first exposure with the antigen or SARS-CoV-2 for COVID-19, people get memory cells, but we don't till now we are not sure about the duration, and it depends on every individual, because how do you say in the presentation, each individual is unique by its immune system and HLA alleles. So we can't give like duration of the memory cells.
All right, thank you for the explanation. Again, we see the interrelationship between the arts, the communication, and the science. What I wanted to say, I lost the idea. Yes, Dr. Shraf said that we should think about the way we behave, and we should change the way we behave. We should change the way we think, because if we link the way we behave and the way we live, it is not healthy. The way our diet is not healthy. Less physical exercise, not healthy food, exposure to digital, and you see all these telephones, mobiles, and the radiation, the pollution, the chemicals, the insecticide. So all this makes us fragile. So in fact, it is, as I said to Dr. Shroff and to Dr. Kumar, it is a whole society which should move all together with all the sectors, all the segments, all the protagonists, if we want to have a healthier and sound society, and if we want to live in peace. Dr. Preti Ishraf, do you have any questions, any comments?
I wanted to ask you, first of all, thank you. This was very useful, and I'm in Los Angeles currently because my family is here. So I would like to meet you at some point, Dr. Fatima, whenever it's possible at your end, because she's based there. My question is, how do you see different age groups, different generations, and how the disease plays out given the diversity in our immunological systems according to age, according to gender, and different ethnicity also? Are there variations?
Uh,
Can
yeah,
she
yeah,
hear me?
I got you. Thank you for the question. As I said before, it's about um, genetic and especially HLA. So everyone got a unique immune system, and they could have some alleles which cause an aggressive immune system. So even, for example, young people that gets this kind of aggressive immune system could develop severe COVID. So
Dr. Fatiha Hilali, there is, it seems to
it's
me
not
that
about to.
there is a contradiction. You see, when you have an aggressive system, this means that you have a good system. But at the same time, you are
No.
more in danger. There is something, what is wrong?
Yeah, I give the example of two cars. If you have two cars, the one which is driving at 30 kilometers per hour, and the other one which is driving at 60 kilometers per hour, the crash won't be the same. Do you agree? So some people got this aggressive immune system, and they think that they got like ill often. They are good for evolution, but for some trigger, they develop some serious immunological trouble, autoimmune disease.
Well, I think that they
They
are
could
so
deal
happy.
they could deal with some infections like salmonella, gastrointestinal disease, but sorry.
I think we might have lost her.
What? Yes,
I
Yeah,
think
I
we
we
sorry.
are hearing you.
Yeah.
The-
Sorry, Professor, I couldn't hear you.
well,
I think she's frozen.
maybe she has some problems of connection. Yes, we got your idea. Thank you very much.
So
It was
it's
very.
like it's like a mosaic, and age or gender or
We can't
so
hear
to
you.
conclude,
No,
it's the immunological troubles could be caused by many factors, which
Uh, Cases going down, but deaths are very high at the moment. And there
yeah,
are some variants.
sorry for Indian people.
It's very, very difficult for them, and so many now rural
Yeah.
villages are getting affected. That's very serious because they don't have access to doctors or hospitals in the rural areas, and a high number of Indians live in rural villages. So rural
Mhm.
health system is
Yeah, so
also
sad.
very, very sad reality. Go ahead, Dr.
Mhm.
Trisha, are you back?
Yes, I'm back. Well, I just want to thank you all for this. I really don't want to end this wonderful meeting and discussion because it is related to our everyday life with deep concerns that we all have. And as you have all stated, we should work both as a global community but also as local agents in our societies, taking into consideration the differences between people and the differences between cultures for a more healthy and peaceful world. I'm so grateful and thankful to you, or to the three of you, Dr. Kumar, Dr. Pratishraf, and Dr. Fatiha El Hilali, for this exceptional session. Thank you all and see you in another occasion. Wish you
Thank
a
you so much.
healthy future
Thank
and
you.
happy. Thank you very much. See you in
Thank
other
you.
occasions.
Bye.
Bye bye.
Bye.